The patient I'll be reviewing today is a 39-year-old male who presents for his medication follow-up for Suboxone and Paxil. Patient has been 100% compliant with his Suboxone, but has been without his Paxil prescription for approximately 2 weeks. He's been on Suboxone for maintenance therapy for approximately 1 year and Paxil for depression for about 15 years. There have not been any adverse reactions to either medication. He reports still having cravings for opioids, but denies illicit drug use. Patient first reports using illicit opioids for the first time 5 years ago, and with his last use being approximately 3 months ago. Previous urine sample results confirm this reporting. He is still at high risk for relapse because he is still in the same environment and sees the same people that he did when he was actively using drugs regularly. His typical day is also unstructured as he still sells illicit drugs in order to pay his bills. He lives in an apartment with one roommate who also regularly uses drugs. Patient cites his roommate as a source of support, but states that he has very few other friends and no real family support to speak of. Currently, he is feeling an increase in depression, decreased energy, anhedonia, and sleep. He's reporting a decrease in appetite, but does not report unwanted weight loss. Patient reports poor diet when he is eating regularly, though. He eats a lot of fast food, stating that Taco Bell is like one of his regular go-tos. Patient rates his depression as a 7 out of 10, and his anxiety level is about a 5 out of 10. Patient reports craving intensities for opioids at about a 4 out of 10. Pertinent labs and vital signs were unremarkable. Patient is well-groomed, dressed appropriately for the weather. He's superficially cooperative, but seems guarded, distracted, and makes poor eye contact. His speech is normal. His gait is normal. His mood is depressed, stating that he just wants to go home and lay in bed for the rest of the day. Patient's also anxious about a court hearing that he's got coming up next week. His thought process is linear and goal-directed. There's no loosening of associations. His thought content is normal. No perceptual abnormalities. Insight and judgment are limited, as evidenced by the people he surrounds himself with and the activities that he continues to participate in. Cognitively, he is intact to conversational testing with respect to attention, orientation, fund of knowledge, memory, and language. In regard to his active problem list, we have diagnoses of uncomplicated opioid dependence, methamphetamine dependence that's in remission, cocaine dependence that's in remission, major depressive disorder, recurrent, moderate, and generalized anxiety disorder. The plan for him in regard to his opioid dependence is we're going to continue his Suboxone maintenance therapy, 8 milligrams sublingual films 2 times per day, follow up in 1 week. For his major depressive disorder and generalized anxiety disorder, we're going to order his Paxil 30 milligrams daily. For his methamphetamine and cocaine dependence, which is in remission, we're going to continue to test his urine weekly. He's going to continue to attend IOP counseling, and we're going to continue to encourage one-on-one counseling, which he currently is linked with a counselor, but he's not seeing this person regularly, and we feel would probably benefit from this. That's about it. Thank you.